Hi, my name is Jerel Brandt and I'm a general surgeon. We're talking today about soft tissue masses. A soft tissue mass is typically a ball of tissue underneath your skin that is either bothersome to you or concerning in general. When we talk about soft tissue masses, they typically fall in one of three categories. The first one would be a cyst of some sort, like an epidermal inclusion cyst or a sebaceous cyst. When we talk about an epidermal inclusion cyst, that's simply just a piece of skin that failed to flake off into our environment like it should on a normal basis. In that case, other tissue grows over top of that skin and our body doesn't like that, and so it walls that little piece of skin cell off and creates a sac around it. In that case, that can sit there for weeks, months, or even years without being a problem. But at some point, for whatever reason, it starts to fester. It will get larger at that point, sometimes can turn red and be very painful and uncomfortable. It's not uncommon for it to either get bigger and hurt for a while and then go away on its own, or get big enough to where it ruptures and drains on its own. Or occasionally people will have their primary care physician or an ER provider drain it for them. In those cases, it does feel better once it's drained and it typically improves. It will heal, but it never goes away completely. And in those cases, it typically recurs in weeks, months, or even years, in which case it would have to be removed completely down the road. The second thing it could be would be a lipoma. A lipoma is a ball of fat that sits underneath our skin. Typically, our tissue runs in planes, just like the blankets and comforters on your bed. Typically, you have a comforter on the top of your bed. Underneath, it's a bed sheet, and when your bed is made appropriately, everything sits nice and flat, just like in our body. On occasion, if that bed sheet gets wadded up into a ball underneath the comforter, that would be very similar to a lipoma. Typically, our fat runs in a nice plane underneath our skin, but occasionally that fat can get wadded up into a ball that sits underneath the skin, and that's simply what a lipoma is. The third thing that the soft tissue mass could be would be a sarcoma. Now, sarcoma is a soft tissue tumor, and there's about 70 different kinds of sarcomas that can be anywhere in our body. Most sarcomas are relatively benign or non-cancerous, but some of them can be scary cancers, and in that case, it needs to be diagnosed so that further treatment can be recommended. When we talk about excising a soft tissue mass, we typically do it as a same-day procedure where you come in, you have a procedure, and you go home the same day. When dissecting out a soft tissue mass, we typically numb up the skin all the way around the soft tissue mass with local anesthetic. At that point, either make an incision directly over top of the soft tissue mass or a small elliptical excision over top of the soft tissue mass. Once we dissect down through the skin, I then dissect around the soft tissue mass circumferentially underneath the skin until it's completely dissected out. Once it's completely dissected out and removed, I then use dissolvable stitches that will absorb on their own on the inside to close the skin and glue on the outside. And it takes about 2 weeks for that incision to heal. In the meantime, we send that soft tissue mass off to pathology, where we find out exactly what it is. The risks of the procedure are pain, but since you're awake and if you have discomfort, you can certainly let me know and we can give you more numbing medication. Bleeding or infection. If you do get an infection, occasionally you do need some antibiotics to help improve that, or rarely we have to open up the incision and drain that infection out. In very rare situations, it is recommended that we take you back to surgery for further tissue in order to get negative margins if it did come back as a cancer. However, thankfully, that's quite uncommon. Typically, once we get your pathology back in 1 to 2 weeks, we contact you and notify you if there's any further steps that need to be taken at that time. If you'd like any further information regarding soft tissue masses or what removing them might look like, please feel free to schedule an appointment with me at your convenience. Thank you.